speaker, Dr. Sumit Lahane, who will be speaking about ruthenium 106 plaque brachy in management of OSSN with scleral invasion.
Good evening, respected dais and everyone. I would be talking on the invasive OSSN treated with the plaque brachytherapy ruthenium 106. I have no financial disclosure to be made. As we know, orbital exenteration being one of the last weapon in the any ophthalmologist armamentarium to treat any disease surgically to remove it completely. It becomes a radical surgery and also gives a lot of morbidity to the patient post-surgery. If we look after all the orbital exenteration studies, we'll see that the squamous cell carcinoma is one of the most common etiology for which the surgery has been done. So as my previous speaker emphasized, there are new modalities of imaging, and of course there is topical chemotherapy and the immunotherapy that can be used to treat this kind of OSSN, but we know it is not useful in cases of the invasive variety of the OSSN. So we decided to do a study in which we treated these patients with the something known as ruthenium 106 plaque brachytherapy, and we studied the outcome in terms of recurrence, metastasis, globe salvage and the vision salvage. We had 49 eyes of 49 patients. This was retrospective interventional study. Inclusion criteria was post-excision biopsy, histopathological base positivity in all the cases, and sometimes the clinical scleral invasion. Exclusion was base negative and the histopathology. So study protocol that we followed was all the patients were thoroughly evaluated clinically, and the Rose Bengal staining was done. Excision biopsy with the no-touch technique was done, which includes the excision of the tumor with the 4 mm safety margins, with double freeze thaw for the excised margins, followed by alcohol keratoepithelectomy depending on the corneal involvement, and partial lamellar sclerectomy. After that, the excision biopsy sample was processed by the ocular pathologist, and the tumor-based positivity was confirmed. After the confirmation of the tumor-based positivity, all these patients after interval of 3 to 4 weeks were treated with the secondary plaque brachytherapy with ruthenium 106 around 5000 centigrades base dose, apex dose. So we had total 49 patients, 32 males and 17 females, and the average age of 49 years. Mean tumor diameter was 9.5 millimeter. Treated height was 2.2 millimeter, and the radiation dose that was given was 5200 centigrades. So on the outcome, the 43 patient had a complete total regression of the tumor. We had a local recurrence of the 6 cases. Out of those, the 2 cases were treated with the repeat plaque brachytherapy, and the 4 patients out of this other 4 recurrence, which were much more invasive, they were treated. The 4 cases of them were treated with the extended 3 of them treated with the extended enucleation, and 1 had to undergo orbital exenteration. There was no systemic or the local metastasis though. Vision improvement of course was noted in the 10 patients, and the eye salvage could be achieved in the 92% of the patient. Duration of the follow-up was variable between 1 year to 5 years, but the 1 year was the minimum follow-up that we had. Complications, we did have a complication in only 2 of the patients. There was a corneal epithelial defect which was persistent for a month, later on treated by the bandage contact lens, and patient was doing well. One of the patient had scleral necrosis and had to be treated with the scleral graft later on. These are some pre-operative and post-operative pictures. You can see a large diffuse kind of a OSSN. It was also invasive. After the removal, it was confirmed, and that was secondarily treated with the plaque brachytherapy, leaves a minimum scar and the clear cornea. This is one more tumor. Again, this that's quite a trilobe kind of a tumor, but it could be completely excised. Base was diffusely positive, more than 2 clocus, and it had to be treated with the plaque brachytherapy. And nicely scarred conjunctiva can be seen post-operatively 2 months itself. So coming on to the discussion, what we want to emphasize with this study is that complete termination of the tumor in an attempt to minimize the risk of recurrence, which comes because of either positive margins or the positive base that can be treated well. Positive margin, everyone knows we can treat with the cryotherapy or the topical chemotherapy, but the base Positivity can of course be treated with the radiotherapy, and it of course improves the chances of globe and the vision salvage. There are some 3 or 4 studies only which have been done with the plaque brachytherapy for the scleral invasion. They had less number compared to the present study, and because of the large number, we still have the globe salvage rate of 92%, which is fairly comparable to the rest of the studies. And so, in conclusion, we would like to say that the ruthenium 106 plaque brachytherapy is effective in cases of invasive advanced OSSN, and it is very safe procedure, and it also can cause globe and the vision salvage in such extensive cases which would have been exonerated otherwise. Thank you.
Thank you, doctor. Is this treatment modality easily available, or?
It's available only in 4 to 5 centers in India, sir. But as we know, the incidence of invasive OSSN is also low. The patients are not much more. This 49 patients, they were of the from right from 2000 to till 2018. So it's though not easily available, but treatment as per is very easy. You need to have a ruthenium plaque itself, and the surgery can be done even under topical or the local anesthesia. Patient need to be hospitalized till the radiation dose has been given and the removal of the plaque is